Good afternoon, everyone. My name is Jonathan Green, Deputy Assistant Secretary for Operations and Resources at ASPR, and it's my privilege to welcome you to today's National Disaster Medical System COVID-19 Service Recognition Ceremony. The COVID-19 pandemic has certainly changed all aspects of our lives, and no doubt at work as well. So instead of a normal award ceremony where we could all be in a room together, we are doing this in a virtual format in a socially distanced way, and I'm coming to you from Washington, D.C. NDMS is needed more today than in any time in America's NDMS is needed more today than at any time in its history. Men and women of the National Disaster Medical System have really provided an essential service to the United States and responded to its call. And while it is by no means, this pandemic is by no means over, and in fact, I imagine that there are plenty of missions left for NDMS as we move into the next weeks and months. We did want to take an opportunity at this time to have an award ceremony or recognition ceremony for the men and women who so far have heeded the call and responded to this event. There will be other award ceremonies in the future for other events, and there will most likely be additional awards provided for additional service for COVID-19. But it's my distinct honor and privilege to be part of this award ceremony today, and I cannot start to tell you how proud I am to be part of this team at this time in history. And it is also my distinct pleasure and honor to introduce our next speaker, Dr. Robert Cadlick.
Thanks, John, and you make me blush. What a kind introduction. First of all, I just want to again add my thanks to you all who are listening and viewing today. And all the work that you've done. COVID has brought on many challenges, I'm sure both professionally and personally to you all. No doubt many of you known people who've been infected and many who have passed as a result of this terrible disease. But through it all, what I've been impressed by most is your incredible professionalism that you do every day in your daily jobs, as in your regular work, and then answer the call when we ask you to deploy. We've deployed over 1,400 responders for the COVID-19 response from January 28th to September 28th of this year. And needless to say, when you think about the breadth of the responses, you've supplied medical surge support in Louisiana, Texas, and Mississippi after Hurricane Laura and Sally, as well as Theta. And even some of you are on alert for Zeta. We're running out of Greek letters, I guess, too. We've also deployed personnel to California and Oregon to support wildfire response. Some of you supported the honors that we gave to Supreme Court Justice Ruth Bader Ginsburg, as well as Congressman John Lewis when they were lying in state in the Capitol. That work received high praise from the Office of the Attending Physician by saying they've been overwhelmed, the members of Congress and the people in the physician's office, by the capability and professionalism of NDMS for many years. And some of you will be supporting the State of the Union address in February. And to John's point, no doubt between now and then, there'll be occasions when some of you, as some of your colleagues are serving today in El Paso, Texas, are working in capacities in support of COVID response. But beyond that, you helped repatriate Americans from China and Japan at the start of the pandemic, supported alternate care sites, and provided staffing for COVID testing. You supported joint patient assessment teams across the country for patient movements with DOD and VA partners. You provided medical augmentation like you're doing in El Paso across the country and early on in some of the Indian Health Service hospitals in the West. All these things you've done, you've worked with local government and states on PPE and nursing facilities, and some of the earliest work in the pandemic was done up in Washington State. So I just want to make sure what you have done. And again, in the state of Maryland, Governor Larry Hogan acknowledged the efforts of NDMS in the crushing curve and saving lives, in stating that Maryland's response to COVID-19 pandemic serves as an example for the rest of the nation. And it's because of your efforts. So one thing I just want to leave is probably the most, and I think most enduring statistic. Nearly 50% of you all were deployed once in the past 9 months, 27% of you twice, and almost 25% of you have been deployed 3 or more times, up to 8 times in some cases. If this doesn't speak volumes of the kind of people you are and professionals you are, I just think it goes without saying. It's been one of my great honors as the ASPR to be part of your organization. Now, this is maybe premature for recognition, but I have to admit, it's a waypoint in this event to take a moment to at least acknowledge all the great work that you've done, and I think that's what you need to understand. And so there is I don't know if you can see it here, but we will be presenting you all with a medal. Yes, a medal to every one of you that will acknowledge your participation and contributions during this unprecedented pandemic. Now, this is not a medal that belongs to ASPR. It's actually with the Assistant Secretary of Health, and we've asked for special dispensation to basically award it to you all for the incredible contributions you've made throughout. And so I just feel in the bottom of my heart that a medal is maybe just a token of our deep appreciation and gratitude for all you've done. For the many Americans who you've touched throughout this event and the many Americans who you'll help going forward, it's a small token of our appreciation. You'll also get a certificate, but I just think the key thing here is to understand what you've been part of is such a great thing. It is the best of America. It gives us hope about the future of America, because people who will respond and in the biblical sense help their neighbors and again ask to be sent any place around the country and the world to provide assistance is one of the greatest humanitarian characteristics that I can think of. And so with that, I just want to say simply thank you. I'd like to turn it over to Dennis Fitzgerald, our Field Ops and Response Director and Readiness Division, to recognize our first group of recipients.
Thank you, sir. Good afternoon, everyone. The Incident Management Team, or IMT, is the critical bridge for a response framework that provides key leadership downrange, supplies vital situational awareness back to headquarters, and ensures the safety of our field providers. During the many COVID-19 response missions, the intermittent IMT cadre, recognized here, selflessly answered the call to help Americans. It's been a privilege to work with you, and thank you very much for your service.
This is Victor Harper. On behalf of the LRAT leadership, Captain Borg and myself, we would like to thank the LRAT for their outstanding duty performance and dedication deploying to multiple locations throughout CONUS and OCONUS and providing critical logistic support. On the screen, you're seeing our recipients. Thank you.
Good afternoon, everybody. This is Joe LaMotta. It's a privilege for me to recognize the groups within NDMS to start. The groups that I will be addressing are the NVRT, the DMOR, and the VIC. The DMOR teams and the Victim Identification Center and the NVRT staff had contributed not only to their specialty and their expertise, but also supported the repatriation operations in various missions and tasks. They supported missions across the country from Southeast Texas to the Navajo tribe to the DMORT operations in Brooklyn, and provided subject matter expertise across the country. So here are the teams.
Good afternoon, everybody. This is Helga. Just want to say a couple of things before we go into recognizing our teams. Just a statement from my heart to each of you. NDMS cares for people when they need it most. That's what NDMS does. And they do it better than anyone else. And it's what NDMS has always done. It's in our character. Whether it's working 48 straight hours without sleep at the Superdome during Katrina, or life-saving surgeries in Haiti in the worst possible conditions, or being on the ground within hours of Sandy, chasing hurricanes across the country, hugging a small child overwhelmed from being in a disaster, supporting American citizens transported in the darkness of night on planes with people wearing hazmat suits, or being removed from the lifelong trip they had always planned on cruise ships for further treatment, delivering meals, acting as baggage carriers on flight lines. It doesn't matter if you were part of DMAT, Trauma Critical Care, DMORT, VIC, or NVRT. You each came together to help Americans. NDMS is always there to answer the call whenever the nation needs us. We are there. This past year has shown the true character of the heroes that make up NDMS, answering the call again and again, putting themselves at risk to save others. So many of our responders deployed over and over again to answer the call this year. Without fanfare, without press coverage, without acknowledgement, and without complaint, when others shut down or ran away, we came. This nation needed us, and we were there. We are here today to recognize those heroic efforts, repeated deployments, leaving their families, their careers, their comforts of home, and their safety to deploy to the latest hotspots, wherever that may be. But they never failed to answer the call. When the nation needs us, you are there. I could not be more proud to lead this amazing group of heroes. I would also be amiss not to acknowledge the dedication and support that our fellow NDMS intermittents from the IMT and the LRAT provide to our medical, mortuary, and veterinarian teams. Together, NDMS program, the IMT, and the LRAT are the NDMS response force for our great country. Now let's go through the DMAT and the trauma critical care to be recognized. I see they started already, so let's go to California 1. California 2. California 4. California 6. California 9. California 11. Colorado 2. Colorado 3. Connecticut 1. Delta 1. Florida 1. Florida 2. Florida 3. Florida 4. Florida 5. Florida 6. Georgia 3. Hawaii. Kentucky 1. Massachusetts 1. Massachusetts 2. Maryland 1. Michigan 1. Midwest 1. Minnesota 1. North Carolina 1. New Hampshire 1. New Jersey 1. New Mexico 1. New York 2. An Old Home Week. New York 4. New York 5. New York 6. Ohio 1. Ohio 5. Oklahoma 1. Oregon 2. Pennsylvania 1. Pennsylvania 3. Pennsylvania 4. Puerto Rico 1. Rhode Island 1. South Carolina 1. Texas 1. Texas 3. Texas 4. Tennessee 1. Utah 1. Virginia 1. Washington 1. Wisconsin 1. The Trauma Critical Care Team East. The Trauma Critical Care Team South. And our last, the Trauma Critical Care Team West. I do want to end this presentation with acknowledging, without the support of the NDMS staff at headquarters, a lot of these things would not be possible. So I thank each one of them, but I especially want to thank Dr. Cadillac, Mr. Green, Mr. Lamanna, Dr. Fitzgerald, and Mr. Harper for the support of the multiple programs to be as successful as NDMS has been and continues to be. So I turn it back over to Dr. Cadillac. Thank you.
Thank you, Helga. And I'd just like to ask everyone to join me in a virtual round of applause for our amazing NDMS team members. All I can tell you is we are proud of you. I just want to remind you a couple things before we go, that your health and that of your family and their well-being are paramount. It's paramount to the mission. It's paramount to you and to your loved ones. And we just ask that you kind of take care of yourselves going forward. I also want to say is that your continued service in fighting this pandemic are indispensable. Indispensable not only to HHS, but to the nation and to the communities that you've served every day in your regular jobs and the communities in need that you've served when you've deployed. So we're grateful for all your hard work, and we know that every day that you go above and beyond your duty in getting this job done, and we know at times you put your own safety and well-being at risk. But first of all, and most of all, I just want to say thank you for your time today, and congratulations on a job well done and a job you're still doing. So stay well, as we say, stay positive, test negative, and God bless America.